Hey everybody, Dr. Hill here. I just came across this article here from Dallas Magazine CEO edition there that this came out in this is their past issue here. And so really what this story points to is the thing that basically I tell patients all the time: you need to do your homework. You need to make sure that your provider is board certified by the American Board of Plastic Surgery alone, not American Board of Cosmetic Surgery. Because what happened at this facility is the owner of the facility had issues with his medical license. Essentially, it got suspended, or there's kind of, this article doesn't really allude to it. Doing some background checks on there, it sounds like there was issues with prescription of narcotics and potentially inappropriate relationships with patients, leading to this surgeon that was in charge of the group not being able to perform operations independently. Fast forward, he brought in this other provider that was listed as a cosmetic surgeon who was basically taking care of patients, doing surgery on them. Patients that were in this article had no knowledge that this surgeon they were seeing was not a plastic surgeon, but was just a cosmetic surgeon who in fact was an internal medicine physician who had basically done a weekend or month-long fellowship on how to do procedures and was performing them potentially by himself, potentially with this other surgeon who had their license essentially suspended due to the fact that there were issues with inappropriate relations with patients. Needless to say, there were quite a few bad outcomes. These patients found out about it by basically Facebook groups together. The surgeon that performed the operations was basically, the patients tried to reach the surgeon at the facility, kept being told by the facility that the surgeon was out, was on vacation. Well, come to find out, the surgeon who had performed their operations, the internal medicine physician, was actually in jail for insurance fraud. Yes. So in reality, these patients were kind of left holding the bag. They had no surgeon who could take care of them. They had some horrific outcomes where basically breast implants were falling out, bad infections, things like this. I mean, this article is terrifying in so many respects. I mean, patients were basically rolling into the operating room table, and while they were getting ready to go to sleep with anesthesia, the surgeon was then changing the plan of what size breast implants, what they were going to do. I mean, these are things that are basically just terrifying. So really, it's a great read, but really this goes back to the main point that I tell patients all the time. But what's the most important question you can ask your potential surgeon is, are you board certified by the American Board of Plastic Surgery? Because if they are not, then you should just go ahead and turn around and leave, because that certification right there requires a certification, or basically doing a complete plastic surgery residency, sitting for your boards, which, I'll tell you what, is a very arduous process. It shows that you're committed to patient safety, that you're ethical, that your advertising is ethical, that your billing is ethical. But do your homework, everyone. Make sure your person's board certified. Make sure they specialize in cosmetic surgery. If you do have any questions of whether your person is that, you can actually check the credentials on the American Board of Plastic Surgery website to see if they're board certified. You can check their medical license with your state by going there to see if there are any infractions. But please do your homework. Your safety matters. It's not just surgery. It's a big deal, man. Bad things can happen. So anyway, do your homework.